Hi guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. And today we are discussing about PR-31 scenario in medical billing or in denial management. See, this denial states that patient cannot be identified as our insured. By statement, we can understand that insurance is not identifying the patient. So we will now discuss about what are the reasons to get this denial and how we have to work and what is the pre-call analysis for this denial and what is the on-call steps you should have to ask to the insurance representative over the phone call. Also we will discuss now, and what kind of end action we have to take on this kind of PR-31 scenario we will discuss now. So before that, you should have to understand that not only this scenario, every scenario in a denial management, in a AR calling denial management, your job is to do one is pre-call analysis. Nothing but before calling to insurance company, you should have to do a basic analysis on a claim. What is the status on a claim? For example, what happened on a claim? You should have to explore, right? That thing is called as a pre-call analysis. Next one is on call analysis. You have to call to the insurance representative or the phone call as a AR caller. Your job is calling to insurance, yes, but before that, pre-call analysis is mandatory, and on call analysis you should have to ask the right questions to the representative, and if it is required you should have to probe the right information over the phone call, and you should have to request the reprocess also. Some it depends on scenario. So on-call analysis is also very important. And coming to the third point, end action on a claim, you should have to take a proper valid action on a claim to close the claim. This is also very important. So these steps I will discuss now. And before that, for this scenario, why we have the reason, what kind of reasons will get this denial from the insurance, we will discuss now. Okay guys, now we will discuss about why PR-31 denial will come. This denial comes when patient demographic details are incorrect, maximum possible. For example, patient demographic detail, nothing but patient policy ID, patient name, patient date of birth, or gender, or insured name, insured date of birth, or checkbox for gender like male or female. These details are incorrect. There are a chances to get the PR-31 denial. Sometimes what happen if claim is submitted to incorrect payer also. So for example, you have to submit to one payer but you submitted to incorrect payer, that also possible to get the denial PR-31, but it is a less chances. So here I give a note point why the reason. For example, if you submit claim to Medicare, the first and last name should be valid. In for example, if you submitted a claim to Medicare, instead of first name you put you documented like last name in the box number of first name, then insurance will not identify and they will deny the claim like PR-31. For example, the policy ID is not in a format for the Medicare. So we all of you know that Medicare format, as per new MBI, should be in a 11 characters in a alphanumeric format, not like a old SSN suffix. It's not like that. It should be like 11 characters in a alphanumeric format. For example, if policy ID is not in that format, the Medicare will deny like PR-31, because the Medicare always follow their Medicare own guidelines. So we have to note one, we have to observe that if we submitted any claim to Medicare, we have to follow the Medicare payer guidelines. So the demographics should be in that Medicare formats. Okay, coming to note point 2, if you submit any claims to BCBS, first of all, we all of you know that BCBS policy ID has a 3 characters alpha prefix. So based on state, for example, BCBS Kentucky, they have a some alpha prefix. If BCBS New Jersey, then they also have a some alpha prefix. That state to state it will be different. So if you submit any claim to BCBS payers, if the format is incorrect, also the insurance BCBS will give the PR-31 denial. For example, if you submit BCBS without prefix, also you will get a denial like PR-31. So it should be cautious. If you submit any claim to BCBS, please open the patient policy ID card and check with the your CMS 1500 claim form. So check whether it is a valid or not. If it is not valid, please do changes accordingly. So coming to the note point 3, if you submit any claim to Medigap, or Medigap is nothing but Medicare Advantage plans. So simply we all of you know that Medicare supplementary plans are nothing but they supplements the gap of Medicare. So here this Medicare supplementary plan blindly follow the Medicare. So everything whatever they have the rules should be followed by the Medicare. So for example, if you submit claim to Medicare supplementary plans, they tell that we will not process the claim until and unless Medicare process the claim. So in that way your analysis that okay, if you submit any claim to Medigap directly, you have to understand that okay, Medigap will give the denial PR-31. So our job is we have to bill the claim to primary as a Medicare. So in that way also there is a chance to get the PR-31 from the Medigap. And also coming to the note point 4, baby mother policy. Here I given like baby mother policy claims also will leads to the PR-31 denial. So how, for example, I given here sometimes baby first name is Rose and the last name is Butler, but claim is billed with the incorrect first name as a Rosie. Here Rosie name is a mother name. If you submitted a claim as a Rosie with a mother name and last name is a baby name, but insurance is not identified that thing. So in that way there might be chances to get the PR-31 denials from the insurances. So guys, here and also these are the reasons. And after that I given 3 points, verify the patient information in billing software. See, for example, you have to open the claim form and also you have to verify that claim form with the billing software, so whether we submitted with the correct information or not. So and also as a pre-call analysis we have to verify the billing software also for that with demographic details, and also verify the patient information and a patient ID cards. It should be very important because you have to open the patient ID card. If you didn't find any patient ID on your software, open any document, patient document, and check that how the name is there, how the member ID is documented. So based on the documents also you can verify the CMS 1500 claim form. Okay. And your third point I given like you have to check the patient eligibility for that payer. For example, you got a denial from Medicare, you should have to run the eligibility for the Medicare so that you will see what is correct name of the format, and also you can see the policy ID. So everything is matched now, then you should have to understand that okay, this is correct only. So if everything is not matched also, you can understand okay, where is mistake. So here your job is from which insurance you got the denial, please run the eligibility for that particular denied payer for that particular date of service. So this is your job. How to run the eligibility. You have to run the eligibility in a software, or you should have to run the eligibility in any portal if you have access, or if you run, if possible there are any chances you have a access to run the eligibility in your doctor internal clearing houses also, you have to run the eligibility in that any platform. You should have to run the eligibility. You should have to verify whether the demographic details everything is valid or not. So these are the pre-call analysis for the PR-31 denial. Okay, now we will discuss about AR caller on-call steps for the PR-31 scenario. First, sometimes what happen in this scenario, you should have to call to insurance and you are giving patient name and date of birth. The insurance representative will tell that okay, we are unable to find the patient. At that time you should have to ask like, could you please search the patient with the social security number. So you should have to give the social security number over the phone call so that they will try to pull the claim details for you. So if they are unable to find the claim with the patient name, date of birth or SSN, then you should have to verify. That will be becomes like another scenario that patient cannot be identified. It's like different, and patient is also not identified is different. Sometimes what happen, they receive the claim and they have the denial and they have everything. They tell that okay, we have a denial, and it is a denied for patient cannot be identified as our insured. Sometimes what happen, they will not at all find the patient also. So you are giving name, date of birth, SSN, whatever you giving information, they're telling that okay, we are unable to find the patient. So then you should have to take a call reference and that particular call and close the claim, because they are unable to find the patient. So with their data system, you are giving your name, I mean patient name, date of birth, SSN, and insured name, insured date of birth, SSN, all efforts you did, still they are unable to find the patient from their end in their system. Then your job, take the call reference number and close the claim. And here the next question I given, may I know the correct policy ID? For example, they found the patient, they found the patient, everything is okay, but sometimes what happened, yeah, we found the patient and we found the patient with your name and date of birth, but the thing is policy member ID is incorrect, they will tell. At the time you should have to take what is the correct policy ID number. So we submitted one policy ID, but that policy ID is different in a payer system. From payer system the policy ID is different, but the name and date of birth is matches from your side and from payer side. And but policy ID is incorrect, your policy ID is incorrect with the payer side policy ID systems. So at the time you should have to take the what is correct policy ID from the insurance representative, and you should have to submit the claim with the correct policy ID the next time. So that is your job. So your analysis here with the question, may I know the correct policy ID? If the representative giving the correct policy ID, here your job is to submit the claim with the correct policy ID, because the policy ID is incorrect before. So coming to third question, may I know the policy active for the date of service or not? Sometimes what happened, they found the patient, member ID is also correct, everything is correct, but policy ID is incorrect. At the time the scenario also will changes. Yes, policy is inactive for the date of service, but it's also very less chances, but you should have to verify the policy is active for that correct policy. For example, you know, they're given the correct policy ID, but the correct policy ID, policy is not active. At the time your job is to verify what is the policy is active or not for the whatever insurance representative given the correct policy ID. So and also ask the representative what is the payer's timely filing limit to submit the claim again. For example, there some corrections required to your claim, you are submitting now, but there is no timely filing limit. So generally you have to verify what is the payer's timely filing limit, what is the payer ID number. And payer ID is nothing but if you submit any claim electronically, you have to one number is there that is called as a, for individual payer they have a that ID number that is called as a payer ID number. So electronic claim transactions numbers done through that ID, that is payer ID number. So and also fax number. For example, they tell that okay, we don't have any payer IDs, and what is the fax number to submit the claim. For example, they don't have any fax or payer IDs, then we have to submit the claim through paper, right? So at the time you should have to ask what is the claims mailing address to submit the any claims or any corrected claims we require to submit any claims. Then what is the uh, paper mailing address to submit the paper claims. So you should have to take the claims mailing address, physical address to submit the claims through paper. So here the claim number, call reference. For example, you know, everything is there, okay, policy ID is incorrect, new policy ID you taken, and so you checked in your system as a pre-call analysis, there is a no EOB found. At the time you called insurance, they tell that claim is denied for PR-31, and you verified with the patient name and date of birth. After that you found that there is a member ID is incorrect from your end, and from payer end they have a correct policy ID number. And after that you verified whether the policy is active for the correct policy ID or not. If policy ID is active for the correct policy ID, then you don't have a denied EOB with you. At the time you should have to take claim number and call reference number, and also you have to request the denied EOB from the payer, because you should have to post that denied EOB in your respective billing software. For that purpose you should have to request the EOB from the insurance. So After that, what happened, these are the next call steps. So these are the AR call steps, and then what steps required for this claim to close, how you are taking action on this PR31, we will discuss in the next slide. Okay, now we will discuss about the end actions on a PR31 scenario. Here, first end action I given is a resubmit the claim with the correct demographic details. So for example, after calling you found that correct policy ID, then you should have to resubmit the claim with the correct policy ID. Or after calling to the insurance, or after verifying you found that patient names are mismatching, now you have to understand that patient, what is the correct patient name, then you should have to resubmit the claim with the correct, with the valid demographic details. That is the first end action on a claim. So you have to submit the claim again to the insurance with the correct demographic details. That is the end action. Second point, you should have to submit the claim to valid primary payer. So for example, I give an example, Medigap, or for example you submitted to some other payer directly, incorrectly to the first time. At the time you understand that there is a some other insurance is there, valid primary insurance, then your job is to submit the claim to valid primary payer. That is your job. So submit the claim to valid primary payer is also end action for this PR31 scenario. And last, after calling, after checking all sources, you unable to find any details, valid demographic details, or you are unable to find any alternative active primary payer details. And also if you are calling to the insurance, you are giving name, date of birth, SSN, all details you provide, also the rep told that we are unable to find the patient, then your job is to bill this claim to the patient, because you are unable to get any details about the patient with the insurance data, I mean sorry, with the payers data. So yes, so from payer side you are unable to get any data from this patient, nothing but patient is not found from the insurance. Then also this will go to bill patient. What happened is sometimes demographic details not correct, but you are checking multiple ways, but you are unable to find out the valid demographic. At the time also bill patient. So you see, these are the actions I given. First is you have to resubmit the claim if any details are found. Then if you are unable to found, you have to bill to patient. This is the end actions of a PR31 denial. Guys, if you are watching my video first time and if you not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth, and hit the bell icon so that you will get every notification as a my video to your mobile. Guys, if you felt content is useful, could you please like my video so that it will reach us many more needy people. And really again I'm telling thank you for your time. Have a good health. Bye for now.